Well, hello and a very warm welcome to the fourth edition of Business Today MindRush. For the last 4 years, we've been putting together this specially curated event to get your mind buzzing with ideas, to help you with ideas, and to even prod you into looking within. So, very warm welcome once again. I'm Shweta Punj, Senior Editor with India Today magazine and your host for today. We have a power-packed day planned for you. Through the day, we will be hearing from the top entrepreneurs, policymakers, and on finding inspiration and on doing business in India. We also have a master class planned for you on the art of negotiation. 1, 2, 3, 4, 5. Okay. Because the fact is that life is as good as your ability to negotiate it. But before everything else, we have to listen to what the heart has to say, because matters of the heart are serious business. Can I please welcome Dr. Naresh Trehan, Chairman and Managing Director, Medanta, for our first session. I think he's right here. Dr. Trehan, over to you.
Good morning. First of all, thank you for inviting me. Second, I'm not sure you want to hear all this bad stuff early in the morning. But anyway, I'll share it with you. There are good and bad parts of it. So if we see today, there are some very sober statistics or data. Will it not move? This is not working. Reverse it. No. Okay, we got it. Okay, so one thing about heart and cardiovascular systems, today we know that 50% of all deaths are going to be either from heart disease or cardiovascular disease. All other diseases, of course, there are non-communicable diseases, there are communicable diseases which still have a role to play in our health system. But today we are going to basically deal with non-communicable diseases. So that means, which way am I supposed to? Okay, this way? All right. So what is the problem with India? India is the capital of coronary artery disease. In addition to that, diabetes is the other cousin which is wreaking havoc on our country. Today, we have almost 60 million people who are suffering from florid diabetes. 70 million are pre-diabetics. So if you allow 70 million people to actually become diabetics, India would have 150 million people, which is over 10% of the population that will be diabetic. And diabetes is one of those diseases which does not spare any organ of the body. So if we look at it today, what is the R, and this I think will be the most important slide for you to understand, to relate it to yourself. So if we go from left to right, two things you have no control over. That's age, your family history, and your sex. These are three important factors for you to understand. Because if there is in your parents coronary artery disease, that means heart attacks, or any form of coronary artery disease, then the children will have double the incidence of heart disease. So if we take the normal population, in the urban areas, we estimate about 12 to 15% of the people will develop heart disease. In the rural areas, about 8%. That means that if one parent has heart disease, then the chances of that person developing heart disease becomes 25%. And God forbid, if both parents have it, the chances will be 50%. Not to say that you can't do anything about it. If you understand your genes, we can make a difference, and I'll walk you through it later. On the other hand, sex, till the age of 50, till women reach menopause, there is 9-to-1 ratio, 9 for every 9 men who will develop heart disease, only 1 woman will develop heart disease. But as they lose their protection from estrogen, which is the hormone which keeps the arteries supple, they start catching up, and by the age of 65, men and women have the same incidence of heart disease. So women should be very careful while they are reaching menopause, that their systems must be checked properly and all their risk factors reversed. Then we have some of the biochemical and internal problems that we may experience is like high blood pressure, tendency. That also has genetic propensity. Diabetes I told you about. If one of your parents has diabetes, there's a 25% chance that the children will get diabetes. And if both your parents have diabetes, then there's a 50% chance. So, in other words, people who have family history of heart disease or diabetes should actually recalibrate their thinking about their own body and their health matters. Other things like deranged blood, like high cholesterol and other lipids, of course, can be checked. So we recommend that by the age of 30, for people who do not have any major history or genetic propensity for heart disease or diabetes, by 30, a good screening, a full screening should be done so that we know our risk factors and they can be modified. The beauty about heart disease is, one, it's morbid. The other part is a large part of it can be modified, either reversed, prevented, or treated depending on when we find it. Smoking, of course, is the biggest risk factor below the age of 50. So we know people who smoke, chain smokers, tobacco chewers, tobacco in any form. I'll show you what tobacco does a little later. But then their tendency or their propensity for coronary artery disease becomes double again. Then, of course, what you do to yourself. So this is one way is physical activity. Lack of physical activity is a given disaster. Obesity, if you are more than 10% of your ideal body weight above, you start getting every disease possible. So that means the tendency for heart disease increases, the tendency for diabetes increases. And as I said to you, diabetes does not spare any organ. So you may say, you diabetics are a little bit careless about being so obsessive about their blood sugar levels that it's like holding, in childhood we had the chemistry lab where we used to have a burner, and if you put oxygen on it, the flame would go double. That's exactly what high sugar does to your cells. If they were going to age at a certain speed, you add diabetes to it. Depending on the intensity of the diabetes, your body will burn at twice the speed. So you'll find people with diabetes getting all sorts of problems very early in life. So their cardiovascular system goes, their eyes go, their kidneys go, cancer doubles, the incidence of cancer doubles. So one important thing is obesity. Once you put on weight, it's very difficult to take it off. So we have to have, and there are some people who will have genetic tendency, and to fight it is a problem. But there is still the awareness that this will actually take you at a different level in life as you age, and I will show it to you, that there is something that one must get obsessive about. Then, of course, psychological stress. Now, we have stress, all of us have, and I'll talk about what we think is one of the better ways of dealing with stress. Okay, so to simplify what I just showed you, we made a metabolic syndrome. The metabolic syndrome, for everybody to understand their own body, consists of 5 factors. And as you see, it's your circumference of your weight. One thing I'd warn you, you may think that you are wearing a 34 or a 36 size pants. Actually, the designers have downgraded it by 2 inches. So when they come to measure you for customized, and you think you're wearing 34, actually you're 36. So we say if your girth is more than 36, that's one risk factor. For women, it should be 34. Then your blood pressure, if it is more than 140 now, we have revised. Now, that's one of our beauty of our profession. We want to keep people confused. So we say eat ghee, don't eat ghee. Now it's turned around. So now we have raised the limits of blood pressure. 140 by 90, we don't want to treat. It used to be 130 by 85. So we've calibrated it up. So blood pressure, blood sugar, triglycerides, that means your fat in your body, and the HDL, which is the good cholesterol. So if any one of these three factors are out of range, you fall in the metabolic syndrome, and your chances of developing coronary artery disease become more. So how does it happen? If you cut an artery and look at the layers of it, the innermost lining of the, which is called intima or endothelium, I don't know if it'll reach there, but maybe it'll reach here. Anyway, it doesn't, somewhere, anyway. But you can read the endothelium. Endothelium is the inner lining of the artery. Now you appreciate the beauty of this. This is the smoothest surface you will ever find in your life. It lets blood flow through it through all your life, maybe 100 years. Millions of gallons of blood is flowing through it, and nothing sticks to the wall. But when you have, where does that come from? Fatty streak formation. Right. So it's gone a little haywire, this. And can you, I can say next and then you can make it, go to the next. Okay. Next, please. I want to show you one. Okay. Go back one. The only thing I want you to imagine, these slides have gone a little, I don't even know what happened to it, but anyway, these are not my slides. So what it shows is that when you breach the inner lining, much like if you cut your finger, the blood comes out and clots immediately, because that's the purpose of the platelets that are flowing in your bloodstream. So alcohol in excess, smoking, which produces spasm of the arteries, damages the inside, high cholesterol with low density lipoproteins, which is the more dangerous cholesterol. All these factors can actually lead to breaching, and one day when the breach is big enough, the blood will clot on it and a person will get a heart attack. That's the mechanism in which we get a heart attack. Next, please. So 3 ways you can find out about coronary artery disease. Next. So the first sphere shows you that you are going for a regular checkup, and we find that there are footprints for you to go into the atherosclerotic phase, and that's the best way to find out. Because at this stage and at the next stage, next slide please, the next stage is angina. That if the blockages are big enough or strong, increased enough, like 75–80% of your artery has been blocked, every time you do a physical activity or a stressful activity, this will again give you chest pain, which will go away once you stop that activity. So if you have it repeatedly, please get it checked and not ignore it, because a lot of people hide it. A lot of people will go in the morning walk and find that they could walk 4 kilometers, now at 2 kilometers they get some heaviness in the chest. They ignore it because of 2 reasons. 1, you're afraid of it, and 2, especially men who are patriarchs, who are, the homemaker and, the bread earner, they are the ones who try to hide it the most, and then they suffer the most. So next slide, please. So if we can detect it in the first 2, that means no damage to the heart has occurred, we are in good shape. If we find out with a heart attack, then the whole statistics changes. Next slide, please. So the survival benefit of detecting in the first 2 spheres is 99%. You can live a long life, healthy life, and a productive life. However, if you miss it the first 2 balls and you go, we detect it with a heart attack, you will then have a 20% mortality, 10 to 15% before you reach the hospital, and 10 to 15% in the first year after a heart attack, no matter how well you're treated, because there are other comorbidities which will cost you your life. So the cutoff point is, you want, if unfortunately somebody has coronary artery disease, you want to know in the first 2 circles, not the last one. Next slide, please. So somebody has coronary artery disease, we suspect, and we say, get an angiogram. An angiogram will show us, and it's the gold standard, that shows us how the blood is flowing through the arteries. Next slide, please. So 4 scenarios may emerge, and I don't know if you probably can see it well. On the right upper hand, you see there are some dents in the arteries, but otherwise the black lines are quite even. This is the best stage to find out if you have coronary artery disease, because it can be reversed medically. With lifestyle change and medical therapy, you can actually reverse it. The next one is the second right upper hand is a blockage which is short but very severe. You see the black dot in the middle of the white line? That's the one I'll show you later. And the right lower one is where multiple blockages have occurred. They are long and they are in the beginning of the arteries, and they cannot be treated by stents, so they will require a bypass. And then the last one is the one is representative of bad diabetics, that arteries have disappeared. Over a period of time, the arteries have got blocked so badly that you can't do anything about it. Now we are using stem cells and all that to give some relief, but actually that's the worst stage to reach. Next slide, please. So once we have made the diagnosis, and if medical therapy is not enough, next slide, then you go over to that slide I showed you on the right upper hand corner, which has a blockage which is cut off in the front artery, and this is very suitable for stenting or angioplasty or rings, whatever you may call it. Next slide, please. So what we do is we take a wire, put it across the blockage, and you can see this is typically how the fat builds inside the arteries. On the wire, there is a balloon and a metal scaffolding. Next slide, please. So we blow up the balloon. The balloon will compress the fat against the wall of the artery, and this metal scaffolding will keep it in place, and you remove the balloon. Next slide, please. So what remains is an open artery, compressed fat, and the scaffolding will hold it. Now, every day new technologies are coming, and it's quite effective in patients who have 1 or 2 blockages, who don't have long blockages, and who don't have blockages in the beginning of the arteries, because in those cases, the tendency of the stents to reclose, to build new tissue inside it over a period of time, is quite high. So for suitable cases, stenting is a wonderful procedure. Next slide, please. And then I showed you the left lower corner, which was multiple blockages, and they will need a bypass. But bypass has now reached a stage where we can produce reproducibly 99% success rate in patients who come to us on time. The infection rates are almost 0, and longevity of this, 95% of people who undergo bypass today will not require another procedure for the rest of their life. So things have refined. Next slide. So what happened? In 95, we changed it from the big trauma that the body used to have, make a big cut in the middle of the chest, put them on a heart-lung machine where we took out the blood from the body, circulated it through plastic oxygenator, and put it back into the body so that you could stop the heart. So the heart and lung function was taken over by this artificial machine, but it made the trauma on the body quite huge, in the sense that you had one, the cut, and the other you had your whole neurohumoral system was thrown out of kilter. So in 95, we started doing it off pump. So 99% of the patients are now done off pump. Next slide, please. And technology came to our rescue. So if you look at it, we don't have to stop the heart anymore. We don't have to take out the blood of the body. The heart is maintaining the circulation on its own, but this device, plastic device that you see, what we call the octopus, is actually keeping that area of the heart where we need to make the connection between the new artery and the old artery, is so stable that the surgeons can reproducibly work on it without any problem. So this has reduced the trauma on the body by 50%. So the recovery, instead of being 6 to 8 weeks, is now 3 to 4 weeks. So that has been some major thing. Next slide, please. And then we started robotics. So robotics, next slide. So robotics means that this is a console, and you'll see me sitting on it. This has 3D vision, 10 times magnification. The patient is about 2 meters away from the console in the operating room, and commands given on this console for every 1 centimeter movement of the hand of the surgeon is translated into 1 millimeter movement inside the body. So this is telesurgery, you can say. So what happens is we put 5 millimeter or a pencil size instruments through 5 millimeter holes inside the body, and those instruments will follow the command of the surgeon this is what's happening. You see these arms moving, the patient is on the table, and the surgeon is actually operating on the console. So if you will see how precise these movements are, it'll now go to a screen where you will see how the internal instruments are following the command of the surgeon. So you will see that there's hardly any blood loss. These instruments, we are taking down the internal mammary artery without, and like you said, the surgeon's accuracy increases because it's 10 times magnification. And one of the things that it has done for the surgeons who develop tremors, it gets rid of the tremor because you can shake on the console and the body will still be treated steadily. So that's some of the surgeons' lives have been saved. Anyway, so what you're seeing here is the heart is beating. We are stabilizing it with a stabilizer. The internal mammary artery, which was taken out, is being joined to the diseased artery, the left anterior descending artery. But the beauty of this is that the sutures are self-tying. So you don't even have to tie them. You just squeeze and it ties itself. So technology has done wonderful things for medicine and for humanity. So you can do many operations, valve replacements, all this stuff, and it's being done regularly in suitable cases. Next slide. So the patient, instead of going home with a big cut in the middle of the chest, goes home with 4 holes on the left side. Next slide. So they can be discharged in 48 hours instead of 5 to 6 days. But all that, if you look at progression of our mind as medical people, we first started treating disease. So we would let people get sick, and on the other end, we would do whatever we could to try to fix them. Then we said, why should we let them get that sick that they will need procedures? So the concept of early detection and prevention actually started. Next slide. So for early detection in heart disease, we started looking for footprints which would give us some clues of who's developing and who's not developing coronary artery disease. Next slide. So we developed the non-invasive method, and by studies we found out that the artery that goes to the brain, which is known as the carotid artery, if the inner lining, which I showed you earlier, intima, is getting thick, and if it crosses 1 millimeter in thickness, then the person has a high risk of developing coronary artery disease, or atherosclerosis is the technical word for it. So if that happens, we can follow people, especially people who have history of heart disease in their family, especially diabetics, so that we know if they are going towards atherosclerosis, so we can get more aggressive with their reversal. Next slide, please. Then came the 256 slice CT. I'm sure most of you have heard it. It's what we call CT angio. CT angio is that you put the dye in the vein. You don't have to put catheters in the body, so it's a non-invasive test in a way. And the CT scan, next slide please, will show you the flow of dye through the arteries. So this is a picture of normal arteries where you're seeing that the pink line is very uniform. Next slide please. On the other hand, if you see, there is where the arrows are, that the left anterior descending artery has developed a very severe blockage. Now the purpose of this is not even to detect it at this stage, but an earlier stage if we can, because if we can detect it before 50-60% blockage, we can reverse it successfully in a large number of people if they follow the recommendations of their medicines and lifestyle. Next slide. Next slide, please. So then we said, we were smart enough to say early detection and prevention. Then what is before? Why do we even not let people assess them for their health, what their future will be? So for that we started studying what happens to the body, and we found out that every 10 years the body changes. And I'll show you, next please. So the whole thing was that we are aging. Aging cannot be prevented, but if you look at the process of aging, can we intervene at any given point a person comes to us to say, can we hold the clock? You may not be able to reverse it, but you can hold it at least a decade longer. And that is to be customized to each individual from whatever knowledge we have today. Next slide. So, basic thing is that if you want to stay well, there is a cause and effect here. You have to make a deliberate effort to want to stay healthy. Next slide. So, you're moving from left to right. So, whether it's all enumerated here, I don't need to read it, but the point being that if you care to go from red to green, it is possible today. Next slide. Next slide, please. Keep going till this slide changes. Okay. So what did we do at Medanta? We said, after studying all this, we said, let's find the balanced wheel of life. And if you look at it here, you will see that we have exploited every element of the human body. Because modern medicine is very effective most of the time, very invasive. We know only three things. Either we'll poison the body with antibiotics or chemotherapy, or we'll cut it out by surgery, or we'll shoot it for radiation like cancer with the most sophisticated beam, nuclear beam we can find. So it is effective in most cases, it is very invasive and very expensive. So are there gems in other forms of medicine which actually kept the world alive for thousands of years, and where are those pearls? Can we take them out of it, incorporate it into modern medicine and come up with a better therapy, less invasive, less toxic, and hopefully at least half the price. So this is what we did, was to take out to say, let's balance the body and find out how the body functions in the combined fashion. Next slide. So we know what are the lifestyle diseases. So we know what leads to it. Living in Delhi or living in India in our society is a hazard, because every night there is some occasion or a celebration, and for every meal that you go from left to right, everything will be floating in oil, and at the end of it there is murder, there is jalebi, rabdi, gulab jamun and kulfi. And just when you have had your rabdi and jalebi, your friend will come up with that kulfi and tell you, you know, how great it tastes and please have some. And by nature we say, yeah, friend itne pyar se laya, so let him kill me. It's okay. On the other hand, there's also another psychological aspect to it. So you have a samosa sitting in front of you. I talk about samosa because I have the biggest weakness for it. So you're looking at it and you say, if I eat it, or if I don't eat it, I'll live maybe 5 minutes longer at the end of my life when I'm 80, 85. So why forget that, man? Let's have it today at least. So this instant gratification is a very strong pull. What you see today, you want it. But the key is in what quantity and how frequently. So nobody says don't have a samosa in your life. Nobody says don't have jalebi, but don't tell the waiter when you're sitting on a table in a shadi, कि ज़रा मीठा ले आना, because he'll bring the full plate of every dessert on the menu, and then it's very hard to resist. After a couple of glasses of wine, you reached another bliss. So the point really is to put some element of discipline in your head to quantum and frequency. These are two words you have to have. So nobody says don't have a paratha. Have a paratha once a week maybe, but then don't have that korma that same night. Do it another night. So the body has huge ability to handle abuse. It's not like body is very fragile. But if you abuse it even excess of that, you're going to be going towards all the lifestyle diseases that are at the bottom of the slide. And as I told you, the ugly head of cancer, in addition to diabetes and heart disease, is a road wreck for us. We have to steer our way through a big maze of problems. Now, pollution and then demonetization now. That, I mean, like Kali was laughing, at least one business is doing well, because she asked me, people getting more heart attacks? I said, surely they're getting more chest pain for sure. So, sorry about that, but little help from Modi. Okay, next slide, please. So this is an important slide I want you to pay attention to. This goes from left to right. Green is, as you see, the age of 30 to 50. 50 to 70 is yellow, and above 70 is red. If you go from left to right, muscle mass is one of the most important things for you, because muscle mass means your posture, your ability, your mobility, and more importantly, your immunity. So people talk about, you know, can we get immunity from, there is a powder, echinacea herb, which is being swallowed by maybe not so many Indians, but the rest of the world every morning, evening, thinking that their immunity is going up. We don't know. Herbal medicine today, undocumented one, has a $62 billion industry. People are popping it without knowing what they are doing, but they believe they want to do something for themselves. That's the key point. So if you really understood what it does to you and spent that much money, you would actually be healthier. So that's what we are trying to do now, is to document what is the cause of effect, what is the active ingredient, what are the dosages, and where does it work. So these are all questions that we have to answer. But in the meantime, as you will see, your muscle mass keeps decreasing as you get older. And that is the one that actually makes you frail. That's the one that makes you bend over. That's the one that makes you sick. For every winter you start getting pneumonia. So just the simple fact, now the misnomer is here. People believe कि मैं सुबह 4 किलोमीटर घूम के आता हूँ. That was the old dictum, as if you remember your grandfather time, that they used to go 4:30 in the morning, walk, and they were healthy. But today's environment has changed. There is no physical activity. Most people are on the computer most of the day, or if not that, the cell phone. And that has caused huge amount of problems. I'll show you some about it. But no matter how much you walk, and one of the biggest mistakes is golf. You think golf is exercise. Golf is great. No, it's great for your psychological makeup. You can stay away from home for 6 hours every day if you like, which by itself is therapy. And if you ever recorded the boy talk on the course, you'll realize what keeps people going. But it is not to be mistaken for exercise or muscle building. That has to be done separately, because if golf was exercise, women would be exercising every day. It's like shopping, stop and go, stop and go. So you have to be very careful in saying that I want to build. You need to not bulk, because bulking muscle means you are fracturing your fibers, and that will come to bite you another day. So just physical light weights adjusted to your age and physical state is essential for everybody, because that will keep you healthy. Next, you go down the line and you'll see how osteoporosis happens, how 70-year-olds just have a little trip and they break a bone. So if you can assess all this and take care of it, you can turn the clock, not back, but maintain it where you are, at least, as I said, make a difference of a decade in your life. Next slide, please. Is it possible to get a glass of water or something? I don't know, have I run over my time? Please tell me if I've run over my time. So I can rush through. Yeah, right. Okay, I wanted to show you this picture. So I asked the orthopods who love to change joints, especially knee joints, why cannot we prevent, like we are talking about heart disease, why can't we do early detection and tell them you're heading for a knee replacement? Can we warn people early enough? So these are the three pictures, MRI pictures of, as it says, at 45 years of age, and unfortunately this doesn't work, but if you see, the white line is a continuum. That's the lining, that's the cartilage in between the joints. If you can see that white bright light, that's the one which is protecting your joints from wearing out. If you do not maintain enough muscle strength, it will start wearing off, and you see that line has got disrupted at the bottom. And then it will go into this state where it's frank osteoarthritis, and it will require, because the bone will start rubbing on bone and it becomes extremely painful. So the idea is to hold it at this stage as long as you can. And the knee joint actually is supported by muscles. You can keep it healthy by just the right kind of exercise for each individual, and you can prevent this from going further to that 61-year-old age, because then it's a little late. Next slide, please. So when I showed them a slide to my orthopods, we save your joints, they kind of fell off the chair. The future looks bleak. But that's what we need to do for ourselves. So what we did was culminated all this into Health Track, and I'll finish in 5 minutes. So please, next slide. And what we did was study, the body is composed of all these organs. If you look at them together and find the balance, because it's a very fine balance. If you are getting obese, your liver will start showing fatty liver. Fatty liver has many degrees, and we have now developed an algorithm which says you can now know what is the structural damage happening to you by fatty liver, which we couldn't tell before. And if it is happening, then we know that you are going to be liver failure or cirrhosis or some part of it as we go forward. So there are many, many technologies that have now developed which will tell us on this ring where you're at. Diabetes will kill your kidneys, your heart. So if kidney function is now not when you start seeing the readings go up, but you can measure the kidney function before it reaches there, and you say, now I can show to a diabetic, excuse me, your kidneys are packing up or going to pack up if you do not change. That vision or that visual will be able to make them more serious than now me giving lectures here, because if I can show you what's happening to what part of your body, maybe you'll find that there is reason to adapt a better lifestyle or a better methodology or posture or living, right? Next slide. So keeping this in mind, we actually do the full checkup and the complete blood analysis to see what are the areas, not only hormones, enzymes, your genes, your telomerase, all that is measured to see where is your body today. Next slide. Now, if that happens, we then, in addition to our modern medicine, do a full Ayurveda evaluation. Now, if you look at it, the Prakriti of your body actually tells you that what is your body's composition, what should you be doing, what should you be eating, what you should avoid, it tells you everything about your lifestyle. That is one analysis. Next slide, please. And the second one is when we do your tridosh, which you fall into kapha, pitta or vata. And unless you experience it, you will think it's all hocus pocus. But I'll tell you, the science will make you understand your body better than most other things will. So if you have the power of the two, next slide please, you will know that actually the body is a balance between the sympathetic and the parasympathetic system. Sympathetic system is what we call flight from fright. You see danger coming at you, you will run. It immediately kicks in, your adrenaline goes up. That is all sympathetic response. The balancing is, you can say yin and yang or whatever you may call it, is the parasympathetic. The parasympathetic, as long as you keep your body in balance between sympathetic and parasympathetic, you can keep yourself healthier as much longer. That's how you see these yogis and all living till 90, 95 and still their bodies are better than ours. So this whole thing you have to understand that every organ is under the same control. There are different centers in the brain that will control it. So next slide. So then we find out that once you have done your full assessment of what your body physiology, chemistry and all that is, next slide, that what is your posture? Because neck ache, backache are the most common diseases people develop as they go forward. So next, so we have all this imaging, I'll show you, next slide. And these are we can map, next slide, we map your lifestyle. So people who are, half of the youth today is working on some kind of computer job, IT, right? So you see the two pictures here, you can see them there. The second picture is that there are little spikes coming out of the vertebrae, which we call osteophytes, and that's the beginning of osteoarthritis. And you got spondylosis, you can get dizzy, you can get neck pain, you can not be able to function properly, and more importantly, you look terrible because your neck goes like that. So there's no reason to be like that. It's not like now I'm aged and I can accept it. You don't have to accept it. And that's the important part. Next slide, please. I'm sorry, I realize I'm talking to this side more than that, but now we'll do the rest of it here. So once you have analyzed everything, next slide. This is a very interesting technology. It's non-X-ray, but it actually breaks up your whole posture and all these images come out. So you know your muscle mass in the red, your skin and obesity, fat on it, and then your spine. It tells you exactly what your spine is doing today. Next slide. And then we make you, so you can tell every 3-degree rotation will work havoc on your body. So if you're walking and your pelvis tilts more than 3 degrees, you are 100% sure to get back pain and develop knee problems because you are stressing on one side more than other. And these are all correctable just by training people, just to make them conscious of it. Next slide. So then we make you walk on a treadmill. This picture is not here fully. That is an electronic pad on the treadmill. It moves. You move with it. And it takes the pressure of where your foot falls, where your balance is, and then puts it all into a master computer. That's what I was talking about, artificial intelligence. Next slide. And then we put you into a robot. The robot actually tests your entire muscle groups. The flexors, the extensors, the left, right, and it will tell you exactly. This all goes into the computer. We don't have to physically calculate it. Then your program comes out with all the 3 inputs about your imaging of your spine and skeletal system, your pressure system, and your muscle strength will give you the full formula of what you need to do, what exercises you need to do, and how you need to keep your posture to make it extend your disease-free state for longer. Next slide. So I think that I've run out of your time, so I also got to go to work. But I'll go through it that you can correct all this. Next slide. Nutrition, I've said enough. This is also enough. You know all this ugly stuff that you have to eat all day. Next slide. So, in conclusion, if you did a combination of all that is here, and you had a knowledge of your body, of where it's at, I can assure you that you can add at least 10 years of good, physically strong life to yourself. So the tagline basically is to add life to years rather than years to life. Because no point living if you're stuck to your bed. Then you become burden on yourself, on your children, and they'll take care of you just so long and then get fed up. And then, it's no fun. So if that's what we can incorporate, so be it. Thank you.